I was going to do a quick video, and then I thought I never really did a proper introduction. I wrote in the comment section a few reasons why I decided to do this channel, and it was because of my many medical diagnoses. And I'm sure there's people out there who suffer from some of the elements that I chose, that I suffer from, as well as the million other things that could be wrong with you. The purpose of this channel is to be therapeutic, mostly for me, to utilize this as a form of medicine, and to educate some people who either have my conditions or know people that experience them, and get a better understanding. I, by all means, I'm not a doctor. I don't have a medical background, although I've spent hours of hours in the waiting room and doctor's offices and surgical centers and surgery and everything else. I'm not giving medical advice. I'm giving my advice, and everything that I'm going to be saying on this channel is from my perspective. If it's information that I found online or was given by a friend or a prescriber or anything, I will let you know that. But again, this is not a medical advice. This is my advice from my experiences and for what I've gone through throughout my life. To get things started a little bit, I will try my best to post often. At this time, I have a lot going on in my life. I wanted to do something yesterday, but I had a pretty rough past 4 days or so. Today is Wednesday, and I started to feel really bad Friday, and it just started going downhill. I started to have a fibro flare. I have MPS also, which is myofascial pain syndrome, and this area here was horrible. My body was aching. It was kind of raining icky, so the arthritis in my back and my hips was bothering me, and I was getting a migraine, but thank goodness for medicine, I just stopped that in the tracks before it got really bad. So I was a miserable person. I went to work, although I should have stayed home, but Mama got bills to pay, gotta go to work. And I just wanted to crash my home. Everything hurt. My breathing hurt. I was in a lot of pain. So I laid for a little bit. I vegged out. I mean, I still have responsibilities, so I've got to push on. So I got some Starbucks. My Starbucks is about 2 minutes down the road. And grabbed some Starbucks, wrapped up some dinner. That's Grayson here. He hasn't barked since I've been home from work early, but he eats until I bring out the camera, and then he decides that he's going to do some barking, so let's ignore him. Unless Teddy starts barking, but he's the one with the tear. They're like kids. It's like when you're not on the phone, the kids don't want anything. As soon as you pick up the phone, Mom. Mom. Grayson's the same way. I'm debating, should I just X this part out, or welcome to my madness? This is typically when I yell for him to shut up, so just hold tight one second. Shut up! Come here, Grayson! Sometimes it works. Sometimes it doesn't. But anyway. Back to me. Crappy day. Things got better. Laid down. I just laid most of the time. I actually had Kevin watch some Fixer Upper on HGTV, which he hates. So that was interesting. But I like Fixer Upper. I like random stuff. But anyway. So this is my therapy. I feel a little bit better today. I do have some baclofen in my system to help relax my muscles. I did take my morphine IR, so it's taken some of the pain away. My medication, just the list alone, is a video in itself, and why I take them. But that's a laundry list. I get a lot of feedback from people and it's mostly negative. Why do you take so many pills per week and blah, blah, blah. I take a lot of pills a week because I have to work. I have to get out of bed and I have to function. I've tried all different types of things, from aquatherapy. I've tried, the hell do you call that stuff? Acupuncture, herbs, meditation. I mean, I've tried a lot of stuff and it didn't work for me. So you do what works for you, and I will do what works for me. And right now, it's synthetic medication that works best for my body. To go over a little bit of my diagnosis, and these are ones that I can think of. I'm a chronic insomniac. Like yesterday, in the last few days, I went about 48 hours with no sleep. Your body's not designed for that. And when you're sleeping, your body heals. And that's in a lot of my problems too. I don't sleep. So it's hard for me to heal. And when I sleep, I wake up really easy. If I turn, it requires me physically moving my body because my back is really messed up from all the back surgeries and other things where I wake myself up. Or when Grayson jumps off the bed, I'm automatically thinking he's about to piss on my floor. So I wake up. So it's very difficult for me to get to sleep. And when I do fall asleep, I typically sleep about 4 hours every day I'm sleeping. I have arthritis. I have arthritis in both my knees, my back, my shoulder, and my hip. But it's all on my right hip. My left hip is pretty good. I have fibromyalgia, which affects the entire body. It's there he freaking goes again. What if I normally go on? I'm anemic. I have to get iron injections and I take iron medication. My body tends to completely repel iron. I have myofascial pain syndrome, and it's centered in the area from here to down here. I get a cortisone injection, cortisone injections. It's like one big valve, but it's equivalent to it's about 20 individual injections in my neck and in my shoulders. Not very soothing, but it does ease up some of the pain some. Grayson, come here! I have seizures. I had my first seizure when I was home on medical or convalescent leave from the United States Army, and I was having problems with my knees, and my knee was killing me, and I'm at the top of my step. This is when I was in Philly, and I told my daughter to give me some water so that I could take my medicine for my knee pain, and I guess the pain was really intense for me, and I fell down my steps, and on my step I had a landing before you go to the next set of steps, and I hit my head, and I had the first of my seizures. That was, I want to say about 12 years ago, 11 years ago, and Grayson! Come here! And I've had them since then. For about a year, I had my driver's license taken away because I was having seizures so much. But through medication, it's maintained, it's monitored. I can't say I'm seizure free. I have about 3 or 4 of them a year at most, but thankfully it's been controlled. I think I was originally on Dilantin that helped control them. So that's another one. Of course, I do have chronic pain, which is pretty much an undiagnosed pain. Well, they can't diagnose with the area because it's so, it's all over. There are days where I can't get out of the bed because I hurt so much. It hurts to go to the bathroom. There's times I haven't even go to the freaking bathroom because I couldn't get up to go, which goes to my chronic constipation, which I take my Amitiza for. But because there's so many medicines that are in my system, and I wasn't a person that had regular bowel movement. And I'm not even worried about TMI because you already know this channel is based on medical, and medical you hear a lot of TMI. So I'm telling you, I don't take shits often. I don't. It's minimal at the very most, even with Amitiza. It's not a lot, and I wish I was one of those people that could go every morning or every 2 days or whatever, but I'm not. So I am being treated for that as well. I have ankylosing spondylosis, which has some days where I wish that I had one less thing wrong with my back, because it's centered at my lower back where I had my surgeries at. That was the area where I had my fusion at. I had a fusion in January 2013, or was it 14? 2014. I had my fusion. I think so. I have restless leg syndrome, which is another thing where I can't sleep because my legs are just kicking and I'm moving and I'm shaking and everything else. So, what are those other things? I have uveitis in my eye, and that's why this eye might look a little different too. It's a little red and irritated now because I was going through a flare the last couple days, a really bad flare where I had almost no vision at all. Like right now, if I were to close my eye like that, I just see like blobs of light, and that's about it. Can't see anything else. And it doesn't feel like there's a migraine in my eye anymore. It just feels like a really bad headache in my eye, and it's dry and it's itching. But I've been dealing with this for 7 years now. And if you know anything about uveitis, which will be another topic, you know 7 years is a very, very long time to suffer from uveitis. Not to mention, I'm pretty much in a constant flare. Yeah. I suffer from depression. Most of my depression goes from, of course, childhood, like a lot of people. I think a majority of mine has to do with my health, having so many different conditions. People don't realize how exactly depressing it really is. I suffer from anxiety. That as well goes on from my medical condition in childhood, life, things that occur. I have OCD, which I don't see as bad, but my kids do. I'm one of those people, like when I have my drawers, I can't have like my socks with my panties or my bras, because who does that? My closet, which I'll do a closet tour one day, as you can see part of my closet too. All the black shoes have to go together. My shoes are like this. My clothes are like this. Everything. Like my closet, which I'm actually sitting in my closet right now. Like the short sleeve shirts must go with the short sleeve shirts, and they have to be in color order. And the pants have to stay with pants. They can't be with skirts because skirts belong somewhere else, and they have to be color and order. Your spices should be in alphabetical order in your cabinet. Makes them easier to find. I mean, most of the stuff makes common sense, but apparently it's to the extreme where I've been diagnosed with something. OCD. I have trick, which is trichomania, and it's a disorder where I pull my hair, and it could be hair on my arms, hair on my head. I try to keep my hair in a protective style so I don't have access to it, because if I don't, I would just rip it out, and I do it happy, sad, depressed, bored, in my sleep. I mean, there's times I woke up and there's hair all over my bed, and I remember pulling my hair out. I'll open up my car door on the side of my car. There's hair. Something that I think I was diagnosed with that at 1 year old. It sucks, but I have migraines, which I manage with medication as well. On the onset of one, I had panic attacks. I've been getting a little bit more lately because of my anxiety level has been just unbearable. A lot of changes have been going on in my life that I can't control, and I'm not a controlling person, but I like to manage things. Yeah, mostly manage things. I have neuropathy in my hands, my arms. I have carpal tunnel in my left wrist, which there's a tattoo there. I don't know if you see it. That's T for my sister Tina that passed away. I have glaucoma in this eye as well. So this year I'm actually supposed to get my glaucoma surgery. So that will help me with my vision. But before I can get the surgery itself, for my uveitis, it's got to quiet down right now. It's really inflamed. It's been inflamed for quite a long period of time, so I can't even get surgery until that's done. So that's on my to-do list. And those are some of them. I wanted to give an overview. And these are just topics that are things that I'm going to talk about throughout time and do a little research about, let you know my experiences from it. Because every person reacts to different things in a different way. I may do something completely different than what you do, but it works for me. And you might do something that you do that works for you, but we might have tried vice versa and it didn't work from us. The thing is this, I get feedback all the time on what I should be taking, what I should be doing, and everything. And typically it's from a healthy person. You're not a doctor. You're not my doctor. I'm doing what works for me. I've done this through trial and error. I've been sick since I can remember. People that are ill really don't need or want to hear you say some stupid shit about, well, maybe if you didn't do this, that wouldn't happen, or maybe you should try this, or you're taking too much of that, or I don't know why you're doing this. No, you don't know because you're not in our position. Don't try to play doctor. Don't try to play God or anybody else for a person unless you're in their shoes. And even if you're in their shoes, everyone wears different size and a different fit. It might not work for another person. So try to be more, and I want to say open-minded because it's not about being open-minded. Try to mind your business, because being chronically ill is hard. It's rough. It's not just physical. It's mental. It's financial. Lord, is it financial. You don't know what we go through on a daily basis. But luckily, we have this channel, and it's going to help educate you. Yeah, I smile a lot, and I kid, and I have to. This is what you have to see. I have a family, and my kids seen me go through some really horrible health times in my life. My kids see me go through radiation and therapy where I was in bed for months. See me locked in my room because I was too sick to get out, or saw where there's days where I just didn't move and they didn't even know I was alive. They would take me to check me. I'm not going back like that anymore. I am going to fight. I can't control everything that's wrong with me. I can't fix everything that's wrong with me. All I can do is try to deal with everything that's wrong with me. And I'm learning as the days go on what works and what doesn't work, or what needs to be amended, or whatever it is. Thanks again for just spending time with me. Let me have my medicine, as I'll say. So I hope you had a wonderful day, a good morning, a good night, or wherever you're at. And I guess I'll be seeing you in the next video. Bye.